Traveling during the winter can be challenging for patients in rural areas across the upper Midwest, especially for folks who need to travel long distances for healthcare visits. Sanford Health continues to make strides in rural healthcare, and the latest tool for patients is virtual care.
We may see it sooner on the breathing test than we see in symptoms with him, though.
Dr. James Wallace is a pediatric pulmonologist at Sanford Health, treating children with lung issues such as asthma and cystic fibrosis. Dr. Wallace is based in Sioux Falls, South Dakota, but today he's seeing a patient more than 500 miles and 7.5 hours away in Dickinson, North Dakota.
From my standpoint, I can see the patient, I can listen to them, I can review lab work or breathing tests as needed. To me, it just seems like a regular clinic visit.
At the other end of the virtual visit, Nurse Allie McLean plays a crucial role in patient care.
Good morning, Dr. Wallace.
She not only handles the exam portion of the virtual care visit, but she also assists Dr. Wallace with the TytoCare technology, which allows him to perform his duties. From hundreds of miles away, Dr. Wallace can hear a patient's heart and lungs and see their ears and throat. McLean says the benefits of virtual care are clear.
When our patients come in, it gives us great comfort that we're able to care for them here in our hometown, that they can receive the specialized care that they would receive in Fargo or Sioux Falls within minutes of their home.
It's in specialized medicine where virtual care becomes a game changer. Every few months, patients like 7-year-old Mason Titus need to see a specialist like Dr. Wallace. Mason has cystic fibrosis, and he lives in Scranton, North Dakota, in the southwest corner of the state. The Titus family used to travel 6 hours round trip to Rapid City, South Dakota. Now they're just an hour away from the clinic in Dickinson. After just one virtual care visit, his mother Alexis was sold.
I was nervous about it at first because I didn't know how it would all work, but with him being able to listen to his heart and lungs and have somewhere for us to go for a breathing test that he can get the results, I think we're getting the same care as we would if we would have traveled to Rapid City.
Dr. Wallace remains a passionate advocate for virtual care as well.
I have a technology that is the best I've ever seen, and we have personnel in each of those places that are trained to do this. And I have been impressed by each person in the areas where we're doing these about how kind they are and how well they work with patients and how committed they are to this too.
Dr. Wallace has performed around 30 virtual visits since they first became available at Sanford Health in April of 2022, helping patients at clinics in Dickinson, as well as Minot, Jamestown, and Watford City, North Dakota. He estimates that in those 30 visits alone, patients have saved nearly 250 hours and more than 15,000 miles rather than going to see him in person. In Dickinson and Sioux Falls, I'm Jason Anschutz, Sanford Health News.